There are four parasomnias that occur during REM sleep, and generally during the second half of the night when REM sleep is more prominent. Some people at times wake up unable to move, sometimes accompanied by an hallucination. This experience, typically lasting about a minute, is called sleep paralysis. It is very frequent, especially during adolescence, and although it can be a component of narcolepsy, usually it is not, and is thus called isolated sleep paralysis. It is a bleeding of REM sleep paralysis into wakefulness for a minute or so. It is benign, thus no treatment is necessary. However, if it causes you stress, you can reduce its occurrence by getting appropriate amounts of sleep, keeping a regular sleep schedule, and avoiding sleeping on your back. Nightmares are coherent dream sequences that seem real and become increasingly disturbing as they unfold. They usually occur at least 10 minutes into an REM period during the second half of the night. Remember that, the second half of the night. The person having a nightmare often abruptly awakens fully alert with an increase in heart rate and breathing rate and immediate high-quality recall of the nightmare content. Emotions usually involve anxiety, fear, and/or terror. Regular reports of nightmares tend to peak at about 10 years of age. A small percent of college students report regular occurrences, and an even smaller percentage of adults and elderly. These numbers may be higher than that, though, because interestingly, sleep lab studies show that people have significantly more nightmares than they remember. Nightmares used to be considered signs of dysfunction, and for years, studies looked for differences in physical, cognitive, and emotional health between sufferers and non-sufferers to no avail. No differences were found. Now research is more focused on possible functions of nightmares. Nightmares tend to increase in stressful times and following trauma or abuse. The current leading theory is that the brain is working through trauma and/or practicing stress responses within a safe environment. Traditional psychotherapy has not been shown to be effective in treating nightmares, but IRT therapy, and that stands for Imagery Rehearsal Therapy, IRT, in which sufferers write or talk about or paint about and/or draw their nightmares, has proven most effective. Recurrent nightmares and bad dreams range from repetitive dream stories that directly duplicate the dreamer's waking concerns to those that focus on the underlying emotional experience of those concerns, but are represented as tidal waves, tornadoes, and/or hurricanes. There is little more to say about recurrent nightmares or dreams than that dream content is a reflection of our waking life concerns. The best evidence that recurring dreams or nightmares occur when we are dealing with yet unresolved issues in our waking lives is that once these issues are resolved, they tend to cease. Following a harshly menacing traumatic experience, some people will experience PTSD nightmares. Most PTSD sufferers, who are most frequently war vets and rape victims, experience recurring nightmares, forcing them to relive their traumatic experience, though not always as an exact replication of the trauma. PTSD nightmares are even more intense, emotional, and distressing than other nightmares. They also differ from other nightmares in that they tend to occur in REM sleep early in the night. Remember, non-PTSD nightmares tend to occur in REM sleep later in the night. They also involve more frequent awakenings, gross body movements, higher activation of the autonomic nervous system, and often a subsequent fear of sleep. Treatment for PTS nightmares is more challenging and complex than that of other nightmares. The treatment must be individualized because of related psychological and medical conditions. IRT can also be helpful with PTSD, but additional psychotherapy, psychosocial therapy, and medications are also often required. This concludes REM parasomnias. In our next segment, we will look at some further miscellaneous sleep disturbances.